Hello, thank you for inviting me.
Kindly introduce yourself.
Okay, so I'm Dr. Abdullah Riaz. I'm one of the general pediatrician currently working in Basildon University Hospital, UK. I do have experience from Pakistan, Republic of Ireland, and UK.
What is microcephaly and how it is defined medically?
So microcephaly is a sign, it's not a disease. In medical terms, we use symptoms and signs. Symptoms is when somebody come and tell you what they are dealing with or what they are suffering with. And sign is when a physician or a doctor examine a patient and notice certain findings. So microcephaly is a sign of a disease. So there can be any underlying disease behind that, which could be birth related, which could be metabolic condition, which could be something infection related.
What are the common symptoms and signs of microcephaly in infants?
So microcephaly patients, they present in different ways. So in developed countries, their growth get monitored. So if somebody is lagging behind in their growth, they do get referred. But most of the time, if they're presenting in hospital, they usually present with the symptoms and signs for the underlying disease, which could be delayed in milestones. If it's infection related, it could be fever or related findings, or something. If it's neurology related, it could be something like seizures. So they do present with the signs symptoms of the underlying disease, and microcephaly is found as one of the signs on examination.
Are there any treatments or interventions available for microcephaly?
So treatments are mainly for the underlying disease. You treat infections, you treat metabolic conditions, whatever is the cause. If microcephaly is purely related with the bone growth problems, skull bones, then it's the surgical intervention. But most of the times, in majority of the cases, is usually treatment for the underlying disease.
What advancement in research or medical technology do you foresee that will benefit individuals with microcephaly in the future?
So there has been a lot of progress, especially in the metabolic field, because that was the field, there was not many options in the past, but now children are managed for metabolic conditions and they do have a good life expectancy. So I wouldn't say specifically for microcephaly, but yes, for underlying disease, there's been a lot of progress and a lot of advancement in metabolic field. From the infections, immunization is very good advancement, but it's been there for a while. So a lot of preventions, a lot of infections has been prevented secondary to immunization.
Lastly, as a doctor, what message would you like to convey to society regarding microcephaly and the importance of inclusivity and support?
So this question depends on where we're talking about. If we're talking about a developing country where there's no proper screening program for growth for the children, and there's no medical facilities which monitor the growth and they are available for the support of the families and community, it's mainly for the parents. So they need to know how is it important for the growth, and they need to see pediatrician for the growth monitoring at regular intervals. If the child is unwell for certain reason, they seek medical advice. It's really important antenatally as well. So when a lady is pregnant, it's very important to get a regular antenatal visits and monitored throughout the pregnancy. For the government levels, obviously it needs a lot of funding. It needs a media campaign. It needs advancements. We need to learn from developed countries what facilities they have and how they monitor around the growth and what facilities are available in the community. But that's still a long way.
Thank you so much, Mr. Riaz. I want to extend my heartfelt thanks to you for taking us for time again to join our interview and share insights and experiences regarding microcephaly syndrome. Thank you so
Thank you so much for inviting. Have a lovely day.